Welcome to Reach Out for Life. It is our goal to present a thoughtful and practical Christianity for today, which you can discover with your mind and live to the full with your life. And now the host of Reach Out for Life, Dr. Larry Bryce.
Welcome to Reach Out for Life. We're so glad you joined us. I want you to meet today two women who have a vision for the Lord and for the people of Africa. Welcome today, Carol Hamilton and Linda Willis.
Thank you.
Carol, we know that you're a professional. We know that you're both a nurse and a minister. Carol, tell us a little bit about your background.
Well, I started my nursing career by attending the University of Toronto and received my degree there, and then went into public health and hospital nursing for a short time. And in 1989 became one of the first 5 full-time nurse entrepreneurs in Ontario. Okay. I started my own private practice, and I worked at that time in education of nurses and also in working with families from conception to the end of the first year. Wonderful. So it was infant feeding and postpartum depression and bereavement.
Wow.
And then through a number of years and many years of practice and working with families, I sort of reached a crossroads, and God gave me a call to go into ministry. And so I didn't completely close my practice, but I downsized significantly and went to Knox College and received my Master Divinity degree and headed into full-time ministry. No idea the plan that God had.
Okay. Carol, just before we ask Linda the same question, this prepared you for your vision to help the people, first of all, in Malawi, in Africa. That practice of helping mothers and babies and transferred over to your care and concern for the children and babies and women of Africa. Could you just say a few words about that?
We, when we went to Africa, which we'll tell a little bit about as time goes on, but we had 2 different interests. Linda had an interest in the education side, but I was very interested in the maternal and infant issues because that was my background. But we also were looking at the devastating effects of HIV/AIDS upon the young women, and particularly the children, the infants that were born also. So it opened my eyes to perhaps a different health challenge in the developing world than the health challenges that I have met in Canada, for sure.
Great.
Yeah.
We're going to get back to that, Carol, in just a moment. Linda, you were a teacher. I think you specialized in special ed. Yeah. Can you tell us a little bit about your background, please?
I grew up on the Bruce Peninsula, but I went to Teachers College in Stratford, a city that I now reside in. Most of my teaching career, though, was in Chatham, Kent, and I did teach mostly special education students for the bulk of those years. All exceptionalities, behavior, children who had learning disabilities, other exceptionalities along the way, speech in some degree, in some ways. I also spent the last 6 years of my career as a resource teacher, which meant that I would go in and help the regular classroom teachers then program for the needs of the exceptional students that they had in their classrooms. And so that was where my heart lay, and you meet many special students and many special families with very special needs when you are in that area.
It sounds also like, Carol, that you had a natural match with the needs of the people in Malawi where you visited. Can you tell us about that?
Well, I think when you see how children struggle who have a difficulty learning, that's one thing. But when you see children that don't even have an opportunity to go to school at all, to even recognize what their full potential can be, I mean, we here know that without an education, your standard of living, your hope for the future is considerably less than those who don't have an education, or who do, I should say. So I think for me, I always said to my own daughter, it wasn't if you go to university, it was when you go to university.
Yeah.
And not that everybody needs to be a university graduate, but everybody needs an opportunity to develop their potential and to have some hope and some opportunity for a good future.
Linda, do you think an education of young girls in Malawi and other places in Africa Do you think an education for a young girl opens many opportunities for that family as a whole?
Absolutely, there is no question. All the research points to that. All the research says that if you invest in a girl, when she is educated and becomes a wage earner, she will invest 90% of that income back into her own family and back into her community.
Wow.
As opposed to the 30% that is the case when the boys become young men and become wage earners. So it is the best investment and the best hope, really, to break the cycle of poverty.
Excellent, excellent. Now, you both are co-founders of this brand new ministry. It's called Change Her World.
Yes.
It's a brand new Canadian ministry. I think it was just incorporated just in 2010.
Mm-hmm.
What is it? What do you do through Change Her World?
Well, if we can go back to how it all started. It started when Carol and I did a HIV/AIDS study and observation tour with the Presbyterian Church in Canada, and our focus was to look at how the funds were being used for HIV/AIDS projects and programs with the donations that were made through the Presbyterian Church in Canada. There were about 7 or 8 of us, I guess, from across Canada went on that tour. And whereas most people go to the southern part of Malawi, into Blantyre and into that area, we were taken to the northern part of Malawi, very remote. So we observed things there that just changed us. Mm-hmm. We saw abject poverty. Mm-hmm. We saw gender discrimination. We saw grandmothers caring for orphaned grandchildren.
Wow.
And so when we came back, we knew that there was something we had to do. We didn't really know exactly what it was. So it's taken us some time to define the mission and the mandate. Mm-hmm. We really had a conversation for years that didn't revolve around what can we do? What are we called to do? Mm-hmm. What is God directing us to do? Mm-hmm. So there was a long time of seeking God's guidance, of pondering, of also doing research to see what was being done, see what worked and what didn't work. And we finally defined our aim was to educate the girls and women.
Educate the girls and women, and just in Malawi, or are you
going
to?
We will do it worldwide. We hope. We kept in contact with several key people when we were there, so we kept that contact with them over these years, and so we feel like we've got kind of a home base with people that we know.
Excellent.
And so we hope to branch out, but northern Malawi is our starting point.
Carol, do you see some need in your mission for work in the health area, newborn babies or moms pregnant? Is there a great need in this area too? Is that part of your mission, or is it more education?
Education is our primary focus because, as Linda said, to break that cycle of poverty, you have to start somewhere. And so the education of girls, getting girls into primary school and then into secondary school and supporting them so that they continue their studies is the key aim of Change Her World. However, having said that, when we came to incorporate as a corporation, not-for-profit corporation in Canada, and as we sought charitable status, we had to define very clearly what our main objects were. And we had initially thought that we would limit it to just education. But if a girl is hungry and there's no food to feed her, she's not going to learn. And so we thought, okay, then we need to focus on basic needs such as food and clean water. We need to focus on those areas. And then as we began to think a little further, if these girls are educated, but they die at a young age because of illness, a simple infection, when we